There were 319 locally acquired COVID cases reported in New South Wales until 8 o'clock last night, and there were 2 overseas acquired cases. This brings 4,929 locally acquired cases reported since the beginning of this outbreak on the 16th of June 2021. As the Minister said, there were 108,449 tests reported yesterday, compared to 109,547 the day before. In terms of hospitalisation, we're seeing lots of cases in hospital. There are now 345 people with COVID in hospital, including 56 in intensive care, of whom 23 are ventilated. Of the 56 cases in intensive care, 4 are in their 20s, 4 are in their 30s, 3 are in their 40s, 19 in their 50s, 8 in their 60s, 14 in their 70s, and 4 in their 80s. So this disease is affecting seriously people of all ages. Of the 56 people in ICU, 51 are not vaccinated at all. 4 have received the first dose of AstraZeneca vaccine, and 1 has received the first dose of Pfizer vaccine. Sadly, there have been 5 deaths since yesterday of people with COVID. A woman in her 80s, a man in his 80s, and a man in his 90s, all from southwest Sydney, died at Liverpool Hospital. These 3 deaths bring to 5 the number of deaths now linked to the Liverpool Hospital outbreak. We've also been notified of a death of a man in his 60s from southwest Sydney at Liverpool Hospital, and a man in his 80s from the inner west who died at Royal Prince Alfred. These infections were acquired in the community. None of these 5 people who died were vaccinated, and we extend our sincere sympathies to their loved ones. There have now been 27 COVID-related deaths during the current outbreak and 84 since the beginning of the pandemic. We're concerned about cases in Newcastle. 4 new cases of COVID-19 have been confirmed in young people in Newcastle, and 2 new cases have been confirmed in Armidale, a woman who recently travelled to Newcastle, and one of her household contacts. These 6 new cases bring the total number of cases in the Hunter, New England area to 13 since Thursday, the 5th of August. There have been 2 confirmed COVID cases who attended the John Hunter Hospital Emergency Department. Anyone who was at the emergency department between 8:40 p.m. on the 5th of August and 1:50 a.m. on the 6th of August is a close contact and must get tested and isolate for 14 days sincere, regardless of the symptoms or outcome of the test. And the hospital is following up with anyone who's at the department at the time. We've seen sewage detections in Dubbo, and we don't have any known cases in Dubbo, so we're urging the community in Dubbo to come forward for testing with even the mildest of symptoms. Take it very seriously. If there's a case there, we need to find them to make sure the community is safe. We're very concerned about Canterbury-Bankstown. This now is the #1 LGA for cases, with 92 cases from yesterday from the Canterbury-Bankstown location, LGA. In fact, we've had 489 cases in the last week, so it's our most prominent LGA. So people in the Canterbury-Bankstown LGA, please take extreme caution, follow the stay-at-home rules, follow all the rules for authorised workers, keep each other safe. Thank you very much.